Hi, I'm Travis Mascarenas,
And I'm Milton Amaya.
and we're the creators of the Sani Cuum.
In the world, we are susceptible to harmful bacteria and pathogens nearly everywhere. Infection by these microorganisms can induce diseases, and treatment for these diseases can cost a fortune. Microorganism contamination can also disrupt scientific research, leading to repeated experiments and increased costs for materials. Each year, there are hundreds of thousands of hospital-associated infections, or infections that are obtained from healthcare facilities alone. According to the CDC, the cost of healthcare due to these infections is estimated to be between $28 to $45 billion per year. The bottom line is our current sanitation approach is severely insufficient.
Currently, the science behind disinfection is that we use these specialized disinfecting solutions that are sprayed onto a surface or an article, and chemically, bacteria and microorganisms are inactivated or killed off, which renders them unable to cause infections. Moreover, the current technical approach is to spray and wipe a surface dry. However, this method is quite time consuming, especially when dealing with larger areas. In addition, this creates waste in the forms of paper towels and wipes.
Our device, the Sani Cuum, is a revamped application of disinfection. We are developing a handheld sanitizing device that disinfects and dries surfaces using a vacuum. Our device is to be used in conjunction with already marketed disinfecting solutions. Our device will use a battery-powered sprayer in order to thoroughly spray a fine mist of the solution to an area, and then dry the area with a vacuum to leave the surface disinfected. We will pursue a provisional patent in order to protect our property and later finalize our device and file for a utility patent. We will also trademark our name and logo. Our product has the freedom to operate, as there is no device that has the combined features of being a handheld battery-powered sprayer with a vacuum.
As of today, our team includes the two of us as co founders and co CEOs. We both have scientific backgrounds with a master's in biomedical science and biotechnology. We will be seeking an advisory board that has experience in the sanitation market in order to help us with our marketing decisions and to work with us on a potential exit strategy. We will also partner with a local manufacturing firm in order to create samples of our product for testing.
A disinfecting device is a product that provides low to medium level of disinfection to any object to prevent infection and contamination depending on the solution employed. The improvements of our device over existing disinfecting technology are numerous. The disinfectant solution is delivered as a fine mist to ensure complete surface coverage and will use compatible third-party solutions, so the disinfectant is already FDA cleared. The vacuum provides fast drying without paper waste generation and will have several filter options. These features together remove the need for physical contact with the surface so that difficult items can be disinfected with ease. Our disinfecting device will overall improve time efficiency by reducing health care associated infection incidents and repeated experiments through these advancements.
We believe we will have the greatest market opportunity as a device that can be used for disinfection, as a greater portion of consumers will use disinfection over sterilization. Anyone that requires a disinfected surface that uses a typical bottle sprayer and physical wipes to dry would benefit from our device. We aim to be primarily used in research labs, both clinical and non-clinical, as well as expand into healthcare settings. Clinical staff, such as nurses and nurse assistants, as well as scientific researchers in both academic and clinical settings, will be the main users of our device. We are targeting this audience based off our own experiences working in these fields. We also performed previous client interviews with potential clients in these fields, in which we received great response and feedback.
Our major competition in this market is companies that produce disinfectors or devices that apply disinfectant solutions. However, we believe we have an advantage over these companies, as current disinfectors are wasteful, limited in their scope of application, and consume valuable time when used. One major distinction we need to make clear is that we are not competing with companies that produce disinfectant solutions. Rather, we will be partnering up with them.
Our major regulatory hurdle will be to be cleared by the FDA. The intended use of our product is that it is intended to be used in conjunction with chemical solutions in order to eliminate sources of contamination. It is intended to clean and disinfect general items and medical devices at a low to intermediate level. Our product is classified as a Class 2 medical device, as it is used in the prevention of diseases caused by the contamination of microorganisms. However, while we classify as a Class 2 medical device, we are also 510(k) exempt based on current FDA guidance documents. These documents exempt disinfectors that offer low to intermediate levels of disinfection to medical devices.
We estimate a total of $1 million for our planned expenses. This takes into account up to $15,000 for research and development, $12,000 for IP protections, $100,000 for manufacturing costs, $15,000 for risk management, $10,000 for our voluntary regulatory actions, and $800,000 for human resources.
For financing our product, we are initially bringing in $100,000 of our own funds to start up the company. This will be used primarily for research and development of our product and all intellectual property protections, which includes hiring a patent attorney for legal assistance with our intellectual property. We will then dive into our first round of investments, in which we plan to raise $1.5 million in return for 25% of equity of our company. We will start as an LLC and transition into an S corporation, allowing for private stock options for our investors.
Our model for sales is a transactional revenue model, in which we will receive a single payment per item we sell. We used a cost-based pricing approach, which is largely based on the cost of producing our product. We then added a 25% markup to the production price in order to recoup business expenses. Thus, with an initial production estimate cost of $60 per device and a 25% markup, we will start the pricing at $75. While we have looked into reimbursement, we do not believe we qualify, as our device is used for facilities rather than for consumers or the patients themselves. This lack of reimbursement will make it harder for our product to enter the market, but we know our competitors also suffer from this as well. At first, our sales will be entirely web orders, but we believe we can eventually end up in retail stores as well. We will also closely monitor our sales and market numbers in order to adjust the pricing of our product.
As for our future hopes with the Sani Cuum, we see multiple directions for growth. We can introduce modularity to our device and sell additional components such as batteries and charging stands. Currently, our device is not marketed for sterilization, as the need for this is limited. However, we do plan to expand into this market. We also plan to expand into a more general consumer market outside of science. We can see our product being used as a household disinfector. We also see potential in contracting with the government for their specific disinfecting needs. And eventually, we plan on going public and launching an IPO. Depending on the profitability and sales of our product, we may field offers to be acquired by larger companies, such as Clorox and Gojo, the makers of Purell. We will field these offers after being on the market for 2 to 3 years.
For any questions or concerns that you might have, please feel free to contact us at sanicuum@gmail.com. Thank you.
Thank you.